Welcome back to another episode of Med City Fem Forward. I'm Marissa Plescia, reporter for Med City News. In this episode, we're joined by Allison Adamson, an architect at Build Health International. We discuss the organization's new Maternal Center of Excellence in Sierra Leone. Hi, Allison. Thanks so much for joining Med City Fem Forward.
Thanks for having me, Marissa. Happy to be here.
Yeah, of course. Maybe just to start, can you just tell us a little bit about yourself and Build Health International?
Yep. My name's Allison Adamson, and I'm an architect at Build Health International. We are a design build nonprofit that delivers high quality, dignified, and equitable healthcare solutions to resource constrained settings around the world. We're based in Massachusetts, though we operate globally and have offices in Haiti, Sierra Leone, and Rwanda. So we often partner with other nonprofit organizations and local governments to provide the architecture, engineering, construction, training, and facilities maintenance, anything you need to provide a strong healthcare infrastructure and systems.
Great, thank you so much. And going off of that, what we're talking about in this episode is the Center of Excellence, the Maternal Center of Excellence that you're building in Sierra Leone. Can you just tell us a little bit about why you decided to create this and why you felt it was important?
Yeah, so this the center, the Maternal Center of Excellence, was born out of our partnership with Partners in Health. They're another US-based nonprofit that provides the care in these resource-constrained settings. So we partnered with their Sierra Leone branch to build this. It was the long-term vision of Dr. Paul Farmer, who founded PIH to provide equitable, affordable, and high quality care in resource constrained settings. And we know Sierra Leone has had a number of aspects in history that's affected its healthcare system, from civil war to the Ebola crisis. And that's led to some of the highest maternal mortality in the world, with 70% of global maternal deaths occurring in the sub-Saharan region. So both organizations saw the need there and saw the opportunity to provide higher quality maternal care to provide a lot of impact there.
Yeah, thank you so much. Yeah, and can you tell me a little bit more about what the center looks like? What kind of care can women get at the center?
Yeah, it's supposed to provide everything from, your outpatient care all the way through delivery. It's a 120 bed facility with antenatal care, postnatal, critical care. There's a labor delivery ward, 30 bed NICU, 2 operating rooms, and about 15 exam rooms for, your antenatal consultations, postnatal consultations. Early conversations, we talked about the design being a beacon of hope for an improving healthcare system in the country, to convey ideas of dignity and trust. Women should come to it and know that they're welcomed and they're comfortable to receive care, and they know they're going to be respected and provide high quality or receive high quality care there. And this shows up in a lot of design aspects around the site. We have a mother's dormitory for mothers who have been discharged from the hospital, but might have a baby in the NICU to stay on the campus. Many women might come from travel hours to deliver their baby here, so we don't want them to make the hard choice of, do I travel home to recover while I leave my baby at the hospital in a rainbow state? So this gives them the option to stay close and heal there. There's a number of education spaces. The staff there really wanted these waiting areas and courtyards to be a spot where families and visitors gather, where they can also go out on like a Tuesday afternoon and give a talk about the importance of antenatal care, or the importance of family planning. Privacy was a big aspect that went into providing high quality and care and making women feel comfortable and respected. So, there's separate wards and exam rooms kind of off to the side for more sensitive procedures, and screening walls around waiting areas, especially for some younger patients too. And just, creating beautiful, clean, and effective and efficient spaces. So we have a MEP team that does all the engineering to make sure the spaces are going to be cool and comfortable and well lit. So that way, the nurses can do their job and the doctors can do their job, and women are getting high quality care with the right equipment that's also clean too.
Yeah, really interesting. And do you have any similar centers in other parts of the world that you kind of used as a model to create this?
Yeah, so BHI actually started right after the 2010 Haiti earthquake, and we built a 300 bed teaching hospital there. And we started doing only work in Haiti for the first couple of years until we've expanded out and done now worked in 70 countries around the world. And we've learned a ton along the way. So every country is different. So we're taking some lessons from Haiti that we did at the university teaching hospital and then applying to Sierra Leone, but also tailoring it to um, the local needs. But we've learned, having pop-up roofs that can provide some airflow and ventilation, having central nurse stations so that way staff can see every patient and keep tabs on them, since we don't often use nurse call stations, and keeping support spaces pretty centralized so that way nurses can go back and forth quickly to get what they need and bring back to the patient. So we've learned a lot from our previous work in Haiti that we're taking forward to all future projects, including MCOE.
Yeah, yeah. Going off that, you mentioned every country is different. So, how did you go about designing this specifically for Sierra Leone? Did you have any input from members of the community? How did that work?
Yeah, we keep the community and the building's users always at the forefront of our design. So we've had many conversations with Partners in Health Sierra Leone, who are running the hospital and operating it and working closely with the clinicians. We traveled there a handful of times to present floor plans and renderings, and got feedback on those to know what was working well with them, what wasn't. Weekly Zoom calls where we go over some of these questions of, how big a waiting room needs to be, what's going to make um, a labor and delivery ward feel comfortable and private while still allowing the nurses to do their job, and what spaces need to be near each other. So it's those weekly phone calls and site visits to see how they're currently operating and how other hospitals are operating in the country to learn what's going to work for them. So we make sure it's what we're providing is actually going to be useful.
Yeah, that's great. And can you tell me a little bit more about Partners in Health's role in this partnership?
Yep. So they are the operating Koidu Government Hospital. It's on the eastern side of the country. And the MCOE is a part of this. So will also run that facility, providing the clinicians, monitoring patient data, and providing the training program. So they're the ones providing the actual care at the hospital, and we're our partners in building this together.
Right. Yeah. Yeah, and you mentioned that Build Health International is a US based nonprofit. Med City News's audience is mainly American. So why is it important for the American healthcare system to be aware of these efforts?
That's a great question. Um, One, we focus on the infrastructure, and we know how important that is to providing high quality care. And I know just from me growing up in the US, taking a lot of things like clean water, the equipment and medicine that's needed to make me feel better I might take for granted, but it's not always available in some of the regions we work. So we know that, to provide the right care and high quality care, it's providing the right building and the right spaces, but also electricity, clean water, equipment, and medicine. And we know maternal mortality is completely preventable. So providing this, also with the right clinicians and staff, that we can work together to help some of these other countries, and give everyone the right to good quality care. And there's also other ways to be involved. You don't have to be a doctor working in Sierra Leone at the MCOE to provide equitable care. We work with a lot of local area hospitals who will partner with, and if they have medical equipment, beds, patient curtains, biomedical equipment that they're replacing, it might still work perfectly fine. We'll take it to our warehouse in Massachusetts and then eventually send it over to our building sites to actually equip the hospitals that we're building.
Yeah, really interesting. Well, Allison, I just have one last question for you. What's ahead for Build Health International in the women's health space?
We're constantly taking on more projects and constantly busy. We are continuing to work with Partners in Health Sierra Leone. Lots more projects that support the Cordu Government Hospital and the MCOE, including a warehouse to um, store medical equipment and medication. Staff training in dormitory is halfway through construction, where we'll hopefully give capacity to hire more staff and give them the training they need to provide the high quality care. A entry pavilion to help triage patients to the hospital and to the MCOE. On my end specifically, we're working on healthcare design guidelines for Rwanda. So we have a number of units, including a maternal and neonatal unit that states all of the important spaces and clearances and things like that. So that will hopefully influence higher quality health service delivery in the country.
Yeah, that's great. Best of luck on those future projects, Allison. This has been such an interesting conversation. Really appreciate you joining Med City Fem Forward.
Yeah, happy to be here. Thank you for having me.